Welcome back to Today's Health. Today we're talking about cancer services, and joining me now is Pat Keigher, Regional Director of Cancer Services at Karmanos Cancer Institute. Pat, thank you for joining us today.
My pleasure, Michelle. Thank you.
Now let's start with, can you share with our audience the significance of being a part of such a comprehensive cancer center like the Karmanos Institute?
That's a very big designation to achieve. Karmanos has obtained that for almost 40 years now, dating back to 1978. To be designated as a National Cancer Institute facility is a very prestigious designation, but it validates the quality of care that we provide to the patients who do come to Karmanos for cancer care. It's a very rigorous process. We're held to very high standards. But again, we're one of 45 across the United States that has that NCI designation.
Now with that designation, how does the care that is delivered at the Karmanos Center differ from the care that is delivered at other hospitals?
To be part of the Karmanos Cancer Center is in itself a very high validation of the quality of care that we're going to provide. All of the cancer centers with Karmanos goes through a credentialing process. All of the physicians are credentialed. A team actually comes out and does an integration site visit to become a Karmanos Cancer Center. It's not just a matter of using their name, it's making sure that we demonstrate and provide the quality of care that follows NCCN guidelines. Those are the ones that should be used across they're the nationally recognized guidelines that should be used in delivering cancer care. So a team of a medical oncologist, radiation oncologist, nursing staff, they all come out and they actually do a one-day site visit, and they look at policies, they look at procedures, nursing practices, all of the things that are involved in providing that care to the patient.
Now what about things like clinical trials?
Clinical trials are a huge piece of a cancer program because first of all, clinical trials are very highly regulated by the FDA. I think sometimes there's a misconception by patients to be part of a clinical trial, but what it brings them is access to promising medications that they may not be able to receive at other facilities. Through Karmanos, we've been able to expand clinical trials to this region, and patients will be getting treatment options and medications that they may not have been able to get otherwise.
Wow, that's a huge benefit. Now, I have also heard that Karmanos is a leader in bone marrow transplants. Can you tell us more about that?
Bone marrow transplants are provided through Karmanos. Again, not a lot of facilities can provide that. They're life-saving. And when patients have that diagnosis, they need to go where they're going to get the best care and be able to receive that bone marrow transplant. So being affiliated with Karmanos through Detroit, we can offer patients in this community and throughout Michigan life-saving bone marrow transplants.
Now, how does genetic counseling help in the treatment of cancer?
It takes cancer care to a new level. Genetic counseling will be available in this community through Karmanos. They have genetic counselors on staff that will be able to provide that care to patients. So it's just another piece of the whole cancer care that we can provide to them.
Now, the staff and physicians that work at the Karmanos Center, are they specially trained or credentialed?
They are. The physicians are all credentialed by Karmanos. Again, as I spoke earlier, we go through a credentialing process not only as a facility, but to be called a Karmanos physician. The nurses all have specialized care in oncology. We have social workers. We have medical physicists and dosimetrists. They actually develop the treatment plan. They do all the planning behind the scenes. They never see the patient, but they're a key piece in delivering that care because they're planning how that radiation, for example, is going to be delivered to the patient based on the treatment plan the radiation oncologist has developed.
Now, the Karmanos Center has access to tumor boards. How does this help enhance the care for cancer patients?
Tumor boards are where a patient is diagnosed with cancer, and then their cancer diagnosis is discussed with a multidisciplinary team. So it's a pathologist, a radiologist, a medical oncologist, radiation oncologist, nursing, the whole gamut, the whole team is there to talk about that patient's diagnosis and what is the best treatment plan for the patient. That is available on site here at Karmanos Port Huron. And then there's also access through Karmanos to electronic tumor boards where we can communicate with the team downtown for unique or complicated cases and what would be the best treatment plan for the patient. So both options are available.
Pat, this has been great information. Do you have any closing comments for our viewers?
Well, I just think that this is a great time for the Blue Water area and this community. For patients who do get a cancer diagnosis, they need to be assured that quality care through Karmanos is now available close to home. Currently, it's estimated about 60% travel outside of this area for their care, and 40% have been traveling outside for radiation oncology. And Karmanos is bringing that here to McLaren Port Huron and close to home.
That's very exciting to have this level of service in our community. Pat, thank you for joining us today.
You're welcome. Thank you.
Stay with us. We'll be back after this break.